Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
1991, my father, who you know I adored, we just lost him a year and a half ago, we brought him to Dr. Lederman. You need to bring yourself or someone you know who needs to have the barnacles scraped off their backside to get their rear in gear and walk in there right now because Dr. Gil Lederman is New York's only triple board certified Harvard-trained radiation oncologist, first brought the non-invasive stereotactic body radiosurgery to America, and he's got the longest experience treating cancer using radiosurgery. So look, do yourself a favor. If it's cancer-related, and I'm talking breast, lung, pancreas, liver, kidney cancers, and more, you got to bring it to Dr. Gil Lederman. He'll send you an informative booklet DVD. You watch it first, you read, you sit down one-on-one with Dr. Lederman, and then you prepare for what it is you want to do and you should be doing. Just call Dr. Gil Lederman at 212-CHOICES. Set up that appointment today, 212-CHOICES, or set it up for someone you know won't do it for themselves. At 212-CHOICES, that's 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD. New York's only Harvard-trained, triple-board certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hello, good morning. It's Gil Lederman, Dr. Gil Lederman from Radiosurgery New York, and we're happy to be here with you live. You can pinch us or squeeze us. Yes, we're live. We're taking your calls, and we're talking about new cancer news. We're talking about patients and learning from patients and learning from the news and learning from each other so we have the best health and the best chance at beating cancer and hopefully avoiding cancer. That's why we're here. So if you have questions, please call us. We have staff on. Rob's on the studio, and he's taking your calls at 800-848-9222. Russ is here, 800-848-9222. So feel free to call us if you wish, and feel free to listen if you wish, and we hope that you're doing great. So the lead story today, and it came out of the Boston Globe, is that 1 in 20 adult patients are misdiagnosed. Wow. Now, how does this happen? Well, I think it happens for a variety of reasons. I think in New York, many patients aren't even given the documents that prove their cancer. Now, when you buy a tire, you get a paper saying the tire was put on, I hope. But so many people don't have pathologic confirmation of their cancer or their condition, even if it's not cancer. You should have a piece of paper. What did the biopsy show? What did the CAT scan show? What did the PET scan show? Do you have that? Have you had scans? Do you have copies of the results? Well, if you came to us, Dr. Lederman, Radiosurgery New York, and our staff, you'd be given copies of your reports, and you can go home in the quiet of your home and read it. Or you can read it when you're with us, and we can go over the reports, and what does this word mean, and what does this mean, and what does it mean the pathologist isn't convinced, or It's not the kind of cancer that you thought you had. Well, we often see people who have cancers that they don't know they had, or they have a different one, or they don't have one. So this 1 in 20, 5%, is not theoretical. How can you eliminate the problem? Well, we think if you give the patient participation in their own condition, and you surely deserve that you're going to be less likely to have a mistake. Now, in this analysis, Singh and his colleagues looked at data from 3 prior studies. 2 were about cancer, and 1 was more about primary care diagnosis. But by looking at 3, they were able to put a fuller picture of the problem and came up with a diagnosis percent of 5% erroneous, wrong. And Dr. Levy, president of corporate quality at Best Doctors, a Boston group, said, one shouldn't be walking out of the office pondering. Don't be shy. Be curious. And went on to say that patients should have all specialists with access to their medical data. Ask for a second opinion when they're uncomfortable or unsure after the first. A good doctor won't mind. Isn't that what we've been saying all this time? Get a fresh second opinion. You're not sure? Get a fresh second opinion. You're not confident with the diagnosis? Get a fresh second opinion. You don't like the treatment options that were given to you, or you don't feel there were all the options. We see that all the time. We had a man walk in with a hole in his head. He had surgery for a brain tumor when he could have been successfully treated, most likely 97% of the time, with non-invasive brain radiosurgery. Was he informed of that? He says no. So get the fresh second opinion. Learn the diagnosis that you have and learn the options about treatment. And you may want non-invasive treatment without cutting and bleeding. You may not. That's your choice. But at least learn the options before you make a decision. It's your right. And speaking about learning, wow. Here's a woman who came in and her family. She had a cancer of the head and neck area. Head and neck area to doctors means the areas around the nose, the nasopharynx, which is behind the nose, the mouth, the throat, the voice box. Those are the head and neck areas. Well, this woman had, last year, a very big tumor. She was 80 years old. The cancer involved areas of the nasopharynx, which is behind the nose, above the mouth, the tonsils, the base of tongue, and below. So she had chemo and radiation elsewhere, and then she went back to her doctor, and he said, nothing worked. We've got to cut this all out. You can imagine cutting out from the back of the nose down to the voice box. You imagine what the quality of life would be. An 82-year-old woman, you imagine how she would swallow and speak and breathe and what she would look like and how she would function. Can you imagine that? So justifiably, her daughter came, who's a doctor, brought the records, and I examined them. And I understood. They didn't do any staging. They didn't repeat any tests. This was all based on one surgeon's opinion. He was going to cut out all that area in an 80-year-old woman, leave her probably incapacitated. Probably she wouldn't even survive the surgery or want to survive the surgery, how she'd be left. We staged her up. We found out where the cancer is today, where it was a year ago, and compared the two, and had it by an independent outside consultant. So we weren't involved, that surgeon wasn't involved, no bias. And what did we find? Well, actually, the cancer was smaller. She was going in remission. She was going in remission in all parts of that head and neck area, except for one lymph node. One lymph node was more intense on the PET scan, picking up more sugar, suggesting recurrence of that. But that lymph node was small, and we could hit that lymph node with fractionated stereotactic radiosurgery. Just hit that lymph node and leave her mouth alone, leave her nose alone, leave her nasopharynx alone, leave her pharynx alone, leave her voice box alone. 5 treatments, each treatment 15 minutes. Get that treated. Leave her alone. Treat the cancer that didn't respond, and leave the rest of her body alone. So, wow. Can you imagine her daughter, the doctor, when she was told the cancer didn't need surgery? This radical, super-duper surgery, deforming, probably incapacitating, wasn't necessary. Wow. Is it worth coming for a second opinion? Well, what do you think? You can call us if you want. We're at 800-848-9222. We're live at the WABC studios. We're nearby our own office, which is in the heart of New York City, which is, I say, super convenient, and it is super convenient. We're by most trains and buses and subways. We had a man who came in from Rhode Island for treatment. He went all over Rhode Island and New England for treatment, and no one had the experience to offer him radiosurgery for treatment of his cancer. He has a melanoma cancer. It spread to a nerve in the spine. The cancer had grown to 6 centimeters and went to other major facilities. He wanted to stay close to home, but no one had the experience, and they said, you better see Dr. L. Well, he came Thursday for treatment, and we've treated him elsewhere. Every area we've treated him, we've treated about 5 areas, has been successfully treated over the last 2.5, 3 years. And now we're treating this lesion that no one will treat. It's not surgical. He's had chemo. Chemo doesn't work. Started on Thursday this week, and by Friday he was better. Friday I had a second treatment. Friday, I walked him out to his car. A friend, the police chief from his town in Rhode Island, drove him in for treatment. Got 2 treatments, outpatient, 15 minutes, turned around, felt better, and drove home for the weekend. So, yeah, we're super convenient, but convenience isn't the only reason to come. The reason really to come is our group was first in America with body radiosurgery. We have the longest experience in America. Radiosurgery means non-invasive treatment. Some people say radiosurgery is the wrong word. It should be called radio buzzing or zapping. But that's the term, and it was meant to imply that we could do with the radiation beam what a surgeon would do by cutting you open. And we want to try to avoid cutting you open. But it's not our choice. It's your choice. And that's why, if you have questions, you should call us at 212-CHOICES, 212-CHOICES, to try to avoid unnecessary cutting, bleeding. When it's feasible, try to get rid of that pain. If you're having cancer pain, or if your treatment's not working, if the cancer's not shrinking, or if you're not tolerating your treatment well, you should give us a call. There may be options available for you. I can't promise you anything. No reasonable person can promise you, but I can tell you that we have a lot of experience and seem to be able to do things that other facilities can't. Now, we're going to hear from our sponsor. We have fresh voices to talk about the work that we do, and we'll be right back. If you have questions, call us at 800-848-9222, and we'll take your call.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal, too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices. With Dr.